We bibi Raeli, we bibi Raeli, we bibi Raeli, kumbuka kitolifanya. Bibi Raeli, kumbuka kitolifanya, kumwambia Pesito, kumwambia Pesito, ebu tuende Kisumu. Kumwambia Pesito, ebu tuende Kisumu, nikawe mimi ni bibi, nikawe mimi ni bibi. Mulipofika Kisumu, mulipofika Kisumu, mulipofika Kisumu, kaiba vitu vya nyumba. Mulifika Kisumu, kaiba vitu vya nyumba, kamwacha Pesito peke, kamwacha Pesito peke.
Oa mwaya makambe safi.
Kumbe bibi wa siku hizi, kumbe bibi wa siku hizi, kumbe bibi wa siku hizi, tuandike watoto. Bibi wa siku hizi, tuandike watoto, wamulinde kunyumba, wamulinde kunyumba, paka miezi 3 ikwishe.
Shauri ya wizi. Wezi ni wabaya.
Lisa mine, idyllisch ravirda trandelina. Iskar kodrute moi kyje, aite moi Lisa mine, idyllisch ravirda trandelina.
Umanda kuohera no keringa thenge Tendo kaigĩrĩrwo guoko nĩ mũndũngĩ Ona ngoro ĩtathirĩte munju Ũgathiĩ Mombatha kũrũgia mwaka nongĩ Tiga gũkihĩra maithori morambu Tũtigũcirĩra wendo ta mũgũnda Choka kũrĩ ũcio mũrarĩ nake Mombatha Kana ũcarie nding'oing'o ya kũhenagia Nĩ ũngĩ ũgwetha we Wanjĩrire wathiĩ kuona aciari Ũmatwarĩre thigũkũ ya mwaka Na tũkĩgũra mĩgate na cukari Mũrata ũkĩmenyaga nĩ ũgũcenjia ruti Tũnyoni nĩ tũingĩ twakũndehere ũhoro Petũro mwanyuire mũtitũ wa ndĩi Warĩ thutha tenere buti ũhetwo Na mwarĩ atatũ hamwe na ndereba wana Njũĩ tu Tiga kwĩyohora mwendwa ke ngũhe ũhoro Warega gwĩtĩkia mbica ndĩ nacio Ona cira mwathitangĩirwo magũrũ Photocopy ya mbundi ĩyo ciothe nĩ ngũkuonia Mũrata wanahenia maingĩ Noreke rĩrĩ rĩtuĩke rĩa mũico Tiga kũrĩra nĩ ũrĩa ũnjĩkĩte Ona twatigana ndiathecire kĩrore Ndiekĩrĩte thaĩri hau Caria mũboi ũngĩ wa kũhenagia Kana ũthiĩ kũrĩ ũcio gũthũkĩtie kĩongo Mumagari nĩ wanjũa igĩrĩ Ona chukari waga nĩ ngũnyua turungi Kana nduya
This is the World Health Organization in Geneva, Switzerland, and it's a very warm welcome to everyone. In today's discussion, which is expected to last for about an hour, we'll be looking at how well we are doing in preventing or controlling neglected tropical diseases that are transmitted to humans through vectors. These infectious diseases get transmitted mainly by mosquitoes, ticks, flies, and bugs, while others penetrate the human body in the form of larvae, only to grow and multiply within the body. Vector-borne diseases disproportionately affect poor communities, mainly in remote settings with weak health systems. In 2017, WHO published its Global Vector Control Response, or GVCR as we call it, for the period 2017 to 2030. Although it came well before the new roadmap was published, GVCR shares several commonalities with this roadmap. So during today's discussion, we'll look at various aspects of GVCR and hear from several colleagues about the achievements and challenges in implementing this global framework over the past 5 years. But before this, I wanted to inform you that this program is being streamed live on YouTube. Here on Zoom, you can access simultaneous interpretation in French and Spanish. And to trigger this functionality, just click on the interpretation tab at the bottom of the screen and select your preferred language. And for those who wish to spread the word on social media, please feel free to do so. and tweet from your personal handles by using the following hashtags. Hashtag beat NTDs and hashtag vector-borne NTDs. And obviously try to tag at WHO in your tweets. For questions and suggestions, please use the Q&A function, and we will do our best to respond to your queries as we move along with the discussion. If we are unable to address your questions, we will try to do so as much as possible after this webinar. But before we get into the discussion, we have with us today Raman Velayudhan, who heads the WHO's Unit of Veterinary Public Health and Vector Control and Environment. Raman, it's a very good afternoon to you.
Good afternoon, Ashok.
So my first question to you, Raman, would be how do you situate the importance of this webinar, and why now, 5 years after it was the document was launched?
Thank you very much. Good afternoon, good morning, and good evening to everyone who has joined this webinar. So to answer this question, basically the GVCR, we are now faced with our first milestone, where we take a review of where we stand today with the implementation of GVCR. And we are submitting a report to the World Health Assembly in May of this year. And this report will come on the web of the WHA, the Assembly website, and you can all access it. So this is one report about which you will hear during this webinar, how much progress has been made. But at the same time, we really need to take stock of where we are. Vector control, and this is the key point, we are having a new roadmap for NTD, and more than 8 NTD diseases are vector-borne. And we still have a lot of work to do cross-cutting between these 8 NTD diseases. And we really need to see how well we can harmonize our work in this direction. So apart from the report, you hear the report as well as you see the challenges faced in various regions. We request everyone to also think about what can be added into this new document. We are developing a companion document for the NTD roadmap so that we highlight the multi-sectoral involvement, especially on NTDs. We know there is Aedes, there is sandflies, there is bugs, there is tritomids, and so on. So all these combined, how can we manage the vector control of these in today's world? And the GVCR document is actually a key cross-cutting pillar for the new NTD roadmap, and we really need to capitalize on it. We are in the second year already of the implementation of the roadmap. So we want to accelerate work on NTD vector control, and we know vector control is an essential component in the arsenal for both control as well as elimination of NTDs. I think I'll stop there. Yeah.
So very much so, Raman, and I think it will be great to have suggestions and proposals for the roadmap's companion document. Also, Raman, I think recent studies have demonstrated the efficacy of novel technologies, particularly mosquito modification techniques and disease control options. How do you view this development?
Well, this is definitely a great period for the past few years. In fact, ever since WHO started the Vector Control Advisory Group, we have had at least 20 to 30% of submissions for NTD vector control, which is really good. So it shows that there is more innovative tools under development. And as many of you may know, that the Vector Control Advisory Group has already approved one tool. Basically, it is the Wolbachia for Aedes control, and this has been proven to have public health value. So we really are looking for more tools. There will be more strains of Wolbachia coming through. There is spatial repellents. We are also seeing exciting times in terms of surveillance tools. There are more unique surveillance tools, and it is time to integrate vector surveillance, because we really need to know where vectors are moving and how these can be capitalized to keep them under check. Over to you, Ashok.
So Raman, new tools and technology are always viewed a little bit with skepticism. How are you planning to promote acceptance of this new method of control?
Well, essentially within WHO, we have a guideline review group as well as a committee which reviews all the evidence base. So basically we are reviewing all these evidence base, making sure the evidence base is strong enough. And then naturally this leads to WHO recommendations. And it is up to countries to take these recommendations and move into the operational phase. In order to help countries, we will also be developing the operational manual for all these novel tools in consultation with all these key stakeholders, so that we have a clear understanding of how and where such tools can be implemented and what benefits we can envisage.
Okay. Thank you very much, Raman.
Thank you.
So let's continue with the first part of today's discussion then by looking back at what has been achieved. So today we have with us Henk van den Berg, who is the lead author of a progress on a report on GVCR. Henk, how is GVCR different and what have we achieved since 2017?
Yes, hello Ashok, and hello everyone. I can show that with some slides. If Simon, please show the slides. The GVCR is basically based on the concept of integrated vector management. And this diagram shows the framework for it. It has two foundations, capacity building and research and innovation, very important for vector control. And based on that foundation, you see 4 pillars of action. The first one being strengthening intersectoral and intrasectoral collaboration, including collaboration between disease programs, for example. The second pillar is community mobilization. The third pillar is vector surveillance. And the fourth pillar is scaling up and integrating of the actual vector control tools and approaches. Now on the right-hand side, I can't see it on my screen, but there is a number of enabling factors like country leadership, normative support, several enabling factors. So all these elements together will then lead on top to the effective, locally adapted and sustainable vector control, with the aim to reduce the burden of vector-borne diseases. So that in a nutshell is the GVCR. And if we go to the next slide, please. We've already heard about the roadmap for neglected tropical diseases, many of which are vector-borne diseases. And we see that the GVCR is remarkably consistent with this roadmap. The roadmap has 3 pillars, but I want to highlight the second pillar here, which is to intensify cross-cutting approaches by integrating approaches across diseases, including for vector control, mainstreaming within health systems, and coordinating between programs. So this is quite consistent with the GVCR. Now, your second question in the next slide regarding what progress we have made. Okay. So since 2017, in the past 5 years, since the GVCR was launched, a joint action group has been coordinating implementation of the GVCR at all levels within the WHO. At regional level, all the WHO regions have welcomed the GVCR and have developed either a vector control policy, a strategy, or a plan at regional level, which is consistent with the GVCR. There's also been progress with the development of numerous guidance documents on vector surveillance, vector control, and also capacity building in countries and sub-regions on vector surveillance, vector control, although there's not been so much progress in this regard on the other two pillars of the GVCR, which are intersectoral collaboration and community participation. Now, as Raman has mentioned, there's also been progress regarding the tools, because there's been a shortage of tools in the toolbox for vector control. But I understand there are now 2 novel intervention classes that have been confirmed a public health value by the Vector Control Advisory Group, with 10 other intervention classes being evaluated. So these are not just products for vector control, these are complete novel intervention classes. So that is hopeful. But then if we look at impact, at what we have actually achieved, which is in the past 5 years, it's only a 10% reduction in the global mortality due to vector-borne diseases. But this falls short of the target that had been set in the GVCR to reach at least 30% mortality reduction by 2020. So it seems we have not been doing all that well impact-wise.
So Hank, is it in terms of uptake of this framework that countries have been reluctant to implement the framework?
I will come to the country level uptake in my next slide, but the impact, of course, you don't know exactly. There are various factors that influence the impact. But overall, we can say we have not achieved the impact that we aimed for, like midway during the implementation of the GVCR. So in this next slide, at national level, if you remember in the GVCR document, there is an outline of a list of the priority activities to be conducted by countries. And there's been a global survey conducted in 2021, and it appears that the GVCR is on track for some activities. Mm-hmm. For example, an adequate number of countries have developed a vector control strategic plan. However, targets have not been reached for most other activities. The activities like establishment of national training programs, establishment of multi-sectoral task forces, or establishment of national research agendas for vector control. These activities have underperformed. Also, there has been only 27% of countries so far that have recently completed a vector control needs assessment, or VCNA. Okay. This is well below the target of 50%. And this is so important because the vector control needs assessment is seen as an entry point for countries to strengthen their vector control systems. Over to you, Ashok.
Okay, so Hank, and rightly so, and this brings me to the next question that we would want to ask. What do you think have been the key challenges then, and how do we surmount these challenges to enable countries to implement this global response?
Yes, thank you for that question. And in my next slide, I have actually put some challenges. Let me say, first of all, that the prioritized activities in the GVCR, they are feasible, but just that progress of implementation has been below the target, we can say. Mm-hmm. I personally think there is a need for a leaner model for the vector control needs assessment, because this is, as we said, the entry point for the GVCR at country level. But then there's also been a lack of staffing dedicated to the GVCR, for example, within WHO. And of course, there's been COVID-19 disruptions to programs at country level, right. Including travel. But foremost, I think, last but not least, the GVCR funds allocated to implementation of the GVCR have been far below the costed plan, including from external donors. And I think that's major challenge that we all have to acknowledge here.
Sure.
Over to you,
Sure.
Ashok.
So as Raman mentioned, this report will go to the World Health Assembly, and evidently we will be able to access this report sometime after May.
That's right, yes.
Okay, thank you very much, Hank, and thanks for your time, and thanks for joining us. So vector-borne neglected tropical diseases are widely distributed in many countries of WHO's region of Africa as well, as you may imagine. Some of the most important ones include lymphatic filariasis, dengue, both leishmaniasis, both cutaneous and visceral, onchocerciasis or river blindness as we call it, human African trypanosomiasis or sleeping sickness, schistosomiasis, and trachoma. We also know that the WHO's region of Africa has massively implemented integrated vector management, or IVM as we call it, which is a key component of GVCR. Let me now turn to Emmanuel Chanda, who is the technical officer in WHO's regional office of Africa in Brazzaville. Emmanuel, we know that your region pioneered the implementation of IVM. How has this approach benefited the fight against vector-borne diseases in Africa?
Implementation of the IVM strategy as a rational decision-making process for optimal utilization of resources for vector control has had good gains in Africa, premised on the 5 key elements of advocacy, social mobilization, and legislation, integrated approach, capacity building, as well as cross-sector collaboration and evidence-based decision-making. Countries have elaborated IVM strategies and leveraged resources. They have also improved entomological surveillance, as well as scaling up interventions with different levels of impact. Unfortunately, cross-sector collaboration as well as integration across diseases remained minimal for quite some time.
Right, and quite relevant, Emmanuel. And may I just ask, how has GVCR helped to enhance the implementation of IVM? Any example you can point to?
Well, GVCR has provided impetus to IVM implementation. The regional office has developed an implementation framework for GVCR, and this has helped countries to implement or develop vector control needs assessments that have also informed elaboration of IVM strategies and aligned them with the GVCR. Countries have also improved collaboration within the integrated vector management, particularly by using the multi-sectoral IVM steering committees. They have also incorporated surveillance data into health information systems. Countries have implemented evidence-based interventions, and they have also implemented innovations and research. Of note is the effect of GVCR on the strengthening of African national vector control. Should I say the African network for vector control response. And this network is a group of 13 research institutions across the region. And the objective of this network is basically to enhance entomological surveillance, vector control, as well as operational and advanced research, capacity building, and provision of technical support to member states. But of note also is that the GVCR is providing the potential for integrating efforts towards tackling different arboviral diseases as well as other parasitic vector-borne diseases. Here I'm talking of Anopheles stephensi, for example, with arbovirus vectors, vectors of lymphatic filariasis and leishmaniasis.
And generally, like elsewhere, Emmanuel, as you know, arboviral diseases have spiked in the African region. What is the level of preparedness in dealing with such an increase?
Well, the region has experienced outbreaks of arbovirus diseases, including chikungunya, dengue, yellow fever, Crimean Congo hemorrhagic fever, Rift Valley fever, as well as West Nile Valley fever. And because of this, the region did carry out an assessment of the situation and elaborated contingency plans. Sub-regional assessments have been conducted on arboviruses in West Africa, and these efforts actually enabled expansion of the TORs for the African Network for Vector Resistance to include surveillance, control, as well as epidemic response of arboviruses in the region. The regional office has also developed or initiated efforts to establish a vector-borne disease program, which is skewed to arboviruses. In 2021, an assessment of country capacities for arboviral surveillance, control, and epidemic response was conducted across the region. And the outcomes of this survey, together with the Global Arbovirus Initiative, will provide a platform on which to tailor the new program to combat arboviruses. But also the region has developed an integrated control, elimination, and eradication framework for tropical and vector-borne diseases, of which arboviruses actually form a core.
Interesting, Emmanuel, but I just wanted to apologize for the sound quality here. I think as we saw in the chat, the sound quality was quite poor. So our sincere apologies for that. Now, as is the case elsewhere, WHO's Eastern Mediterranean region has also witnessed outbreaks of emerging and re-emerging vector-borne diseases, such as dengue and chikungunya. We have with us today Samira Al-Irani, Technical Officer in WHO's Regional Office of Eastern Mediterranean, and she joins us from Cairo, Egypt. Samira, good afternoon to you. What is the current situation of invasive mosquito vectors in your region?
Good afternoon, Ashok. Good afternoon, everyone. I will just share some slides. Okay, so in the Eastern Mediterranean region, there are two important mosquito vectors which are invasive in the region. The Aedes aegypti is, which is the primary vector transmitting dengue, chikungunya, and yellow fever, and also Zika, has established in 7 countries in the region. These countries report dengue and or chikungunya cases. Also in Egypt, it has re-emerged following long years of its disappearance since the 1940s, and local transmission of dengue was reported. And recently it has emerged in Afghanistan. In 2018, there were collections of Aedes aegypti, and there was local dengue transmission afterwards. And also in the Islamic Republic of Iran, a collection of Aedes aegypti was reported in 2019, but no local transmission of dengue. In addition, there was a record of emergence of Aedes aegypti in 2011 in Iraq, where at that time they were identified to Aedes aegypti. A secondary vector, Aedes albopictus, which is a secondary vector of dengue and chikungunya, has also emerged in countries in the Middle East and North Africa. The second important invasive vector in the region, emerging outside its established range in the Eastern Mediterranean region. As you see in the map here, this is a WHO malaria threats map, and the green dots show where the malaria vector is native, and the red dots is where it has spread outside its established range. And if you see here, it's in the Horn of Africa. So the first detection was in Djibouti. And since then, it has been incriminated, established, and has been responsible for the increase in the malaria incidence in Djibouti city. Following this, there were vector surveillance in neighboring countries, and collections were made and identified in Stephensi in Sudan. Then in 2019 in Somalia, and recently in Yemen in 2021. This is an important malaria vector, an Asian malaria vector transmitting urban malaria, and it is also a major vector in countries in the Eastern Mediterranean region, in Afghanistan, in Pakistan, and previously transmitting malaria in Iran.
So, Samira, what are the kind of opportunities that you have had for tackling these invasive species?
I will show this next slide. So this is a slide showing images of the revealed breeding sites following entomological surveys. So as you see, these are man-made habitats and water containers containing stored water in these countries where the invasive Anopheles stephensi was found. And these countries also have Aedes aegypti. So these are common breeding sites for Anopheles stephensi and Aedes aegypti. Most are in the urban areas, but we also have in rural areas, as seen here in Iran. So finding both Aedes aegypti and Anopheles stephensi provides an opportunity for integrated vector surveillance and control in these countries.
Okay, and any lessons learned, Samira, and what could be the challenges that others could face elsewhere?
So the actions that we've been taking is networking, collaboration to support, enhancing surveillance, monitoring, and response. And most important to highlight is sharing information for timely response, as there are still knowledge gaps on the distribution and the behavior and bionomics and control also. And also these vectors are urban vectors, and there's still limited information on the role of these urban vectors, these invasive urban vectors transmitting urban malaria and Aedes-borne diseases. Continuing the capacity building is important to highlight, and there has been cross-border collaboration, and this has enhanced strengthening the integrated surveillance and control. And also when updating the national plans to ensure that the community is engaged, and there is a community engagement component in the plans, because as you saw in the previous slide, these are vectors that breed within the communities, inside the houses, in water stored containers, usually. And also we have also collaborated and partnership with the academia for generating local evidence for informed decision on the insecticide resistance, given that there's widespread insecticide resistance in both Aedes aegypti and Anopheles stephensi. Also, partnerships strengthening resource mobilization. There is limited resources for strengthening vector surveillance and for effective vector control in these urban settings, where we have the current core vector control interventions are not adapted for urban, but for rural. And we need to work together with everyone and also to strengthen the intersectorial collaboration. Thank you.
Thank you very much, Samira, and thank you for joining us. Another region that has a substantially high burden of vector-borne diseases is WHO's Southeast Asia region. India, for example, which has many of these diseases, has made tremendous progress in addressing them. The country has also launched a major initiative to eliminate malaria, lymphatic filariasis, and visceral leishmaniasis, and success is directly linked to effective vector control, surveillance, and control. So joining us from India is Ashwani Kumar, who is the director of the Vector Control Research Center at the Indian Council of the Indian Council of Medical Research in Puducherry. Ashwani, good afternoon to you.
Good afternoon to you, Ashok, and greetings to all from Indian Council of Medical Research, Vector Control Research Center at the Puducherry.
So, Ashwani, how is India overcoming critical challenges to implementing vector surveillance and control?
Yes, much of the success of the elimination of malaria and visceral leishmaniasis depends on vector surveillance, the routine insecticide monitoring, the resistance monitoring, the choice of vector control tools, and also the quantity and the quality of the vector control interventions, and then finally the monitoring of impact assessment of vector control tools in India. In case of lymphatic filariasis, vector control is not the mainstay. It is the mass drug administration with two drugs, DEC and albendazole, and recently the triple drug therapy IDA, ivermectin, the DEC and albendazole has been introduced, and there is an annual mass drug administration to contain lymphatic filariasis. So I must mention here that in case of lymphatic filariasis, vector control is more or less not targeted for elimination.
Okay. So this really brings us, as you mentioned, to a very important issue about capacity building and building capacity to enhance surveillance and control measures. So my other question to you would be, how is the Vector Control Research Center in Puducherry helping to build entomological capacity to meet human resources needs?
Well, being a very large country, as you would expect that, you know, the needs for the zonal entomologists, the state entomologists, the insect collectors, and the field workers would be very, very large. You know, we have 75, entomological zones. And for that, the Vector Control Research Center has initiated Masters in Public Health Entomology course since the year 2012. And we teach students, we have 20 intake every year. We teach students a very structured curriculum, which includes the classroom teaching, the practicals in the laboratories, and also taking them to the real field settings which are endemic for various vector-borne diseases. So that's what is going on right now. And there is also a proposal to duplicate this program in 4 other institutes of Indian Council of Medical Research in the coming days.
Okay, and Ashwani, as you said, your research center considers WHO requests. I believe you do proceed with intake of candidates suggested by WHO.
Oh yes, out of these 20 students, 16 are, taken from the open market, in the sense that, they have to compete, and they have to pass a national test in order to be admitted. And then in addition to that, 2 candidates are sponsored by the state governments, and additional 2 candidates actually are coming from the overseas. So they can be sponsored by WHO or other countries.
And directly from other countries as well.
Yes, yes.
Okay. Thank you very much, Ashwani, for having joined us. It was really very, very interesting to talk to you.
Thank you very much, Ashok. Thank you.
And before we go on to the next segment of our discussion today, so let's just recap on what GVCR is all about through this short video. Yes, and the journey towards 2030 requires robust and sustained control and surveillance activities. Now, my colleague Rajpal Yadav will moderate the upcoming segment of the discussion and will look at what is being done to improve vector surveillance. Rajpal, over to you.
Thank you, Ashok. So I have 3 colleagues in this particular session. So these are the 3 WHO colleagues. One is Dr. Geraldo Becerra from Washington office, Dr. Elkhan Gasimo from the Copenhagen office, and Dr. Jolin from Seattle, New Delhi. So the first speaker, Dr. Geraldo, will speak in Spanish. So I request all to choose your language of choice by pressing the interpretation tab, and you choose English language so that you can English or French, whatever you want to listen. So moving on to Geraldo, my first question to you is that in your region, dengue, Zika, and chikungunya are the main arboviral diseases. So what steps are you taking to improve vector surveillance and insecticide resistance monitoring in your region? Over to you, Geraldo.
Muchas gracias, Rajpal. Buenas tardes a todos. Bem, em nossa região, a primeira atividade que hicimos para enfrentar essa situação, que é uma situação, como você diz, importante para nós outros, foi trabalhar com os países para criar um marco de um sistema de vigilância regional, onde puder estar disponível os principais indicadores para essas enfermidades. E isto ajudar os tomadores de decisão a avançar em la implementação de ações estratégicas de vigilância e controle para esses vetores, para o vetor principal dessas enfermidades arbovirais. Además de isso, para enfrentar o problema da resistência dos inseticidas, trabalhamos junto com os países para criar uma rede regional. Estamos trabalhando também em transferir a tecnologia de produção de papéis impregnados a 2 laboratórios, um está em Argentina, CPI, o outro está em Brasil, em Fiocruz, e tendo a disponibilidade desse insumo, fazer com que a vigilância e a resistência em nossa região possa ser mais efetiva. Además disso, estamos trabalhando com outros 3 laboratórios, um também é Fiocruz, outro é CPI, e um outro laboratório da Universidade de Yucatán, em México, para que esse laboratório logrem certificar em GLP, de boas qualidade de laboratório, e ser um laboratório de referência regional para melhorar a qualidade dos produtos que estão disponíveis em nossa região e aí enfrentar a resistência aos inseticidas. Gracias.
Thank you. So the next question then would be that since you are already working a lot on building capacity, what specific improvements or capacity strengthening you are envisaging for normative guidance and training of entomologists in your region?
Rádio Paulo, eu diria que o primeiro passo aí foi atualizar número importante de guias que nós outros temos na região das Américas. As guias de vigilância e controle de vetores foram atualizadas. Hicimos também uma adaptação de maneira integrada de vetores para a região das Américas. Isso facilita que os países adoptem essa estratégia de uma forma muito mais efetiva. Mas estamos trabalhando com os países para desenvolver cursos virtuais. Recente terminamos um curso com Costa Rica, e o país está implementando. E estamos trabalhando com a Universidade do Brasil, a UNASUS, que é a universidade que é do Sistema de Saúde brasileiro, para oferecer à região um curso virtual que faz um treinamento para as principais enfermidades transmitidas por vetores em nossa região. E este curso será gratuito, será certificado pela universidade e temos a capacidade de treinar pelo menos 50.000 pessoas em as principais técnicas de vigilância, quais são as ações de controle para cada desses vetores que nós outros temos em nossa região, e também seguridade desses trabalhadores, ou seja, há um paquete de atividades que estão sendo para fortalecer essa questão de treinamento de nosso personal, además de ter as guias atualizadas com os mais importantes, as novidades que temos para oferecer a los países. Gracias.
Yeah, thank you, Harold. It's quite heartening that you have planned to train 50,000 entomological workforce in your region, which is quite a unique achievement of your office. Now, I move to Elkan from the European Regional Office in Copenhagen. Elkan, in the European region, invasion of new mosquito species is posing a major health challenge. So what is being done to address this growing challenge in the European region?
Thank you very much, Dr. Rajpal. Yes, indeed, in the European region has experienced an increase in the spread of invasive mosquitoes since 1990s. Aedes albopictus and Aedes aegypti are spreading across parts of the European region. But this is not just about vectors. Since 2007, locally acquired vector-borne cases of dengue and chikungunya are reported in 5 countries of the European region. In 2019, for the first time, there was a locally acquired Zika case in the region. So these events present a clear warning signal to the region that emerging diseases may spread and intensify in the years ahead. So responding to this threat, the regional framework for surveillance and control of invasive mosquito vectors and the emerging vector-borne disease, aiming to guide member states in development and updating of their national operational plans, was adopted by the 63rd session of the Regional Committee for Europe in 2013. The regional office provides guidance to member states on vector and vector-borne disease surveillance and control, strengths and capacities of countries to deal with invasive mosquitoes and emerging vector-borne disease, and raise awareness on vector-borne disease.
Great. So, we are aware that you are working with International Atomic Energy Agency in developing collaboration for SIT, sterile insect technology for control of mosquitoes. What benefits this technique can bring in the European region for control of the invasive species or vector-borne diseases in your region?
Thank you. Our collaboration with International Atomic Energy Agency started just very recently. And I have to say, first of all, that International Atomic Energy Agency leads and implements the project called Enhancing Capacity to Integrate SIT Sterile Insect Technique in the effective management of invasive Aedes mosquitoes. And this project includes a number of countries from the European region. The first Atomic Energy Agency and WHO Regional Office coordination meeting on potential of SIT for integrated control of Aedes invasive mosquitoes in Europe was conducted in Greece back in February 2020. This May in 2022, we are planning a joint training course in Cyprus for countries participating in the International Atomic Energy Agency SIT project on vector control needs assessment. Now, in our point of view, application of SIT in Europe has a big potential and can be one of the important public health tools to control vector population and consequently vector-borne disease. SIT has been successfully tested already in Italy, and it has caused suppression of Aedes albopictus population. So this method has also is also being tested in several other countries as well. So we would like to, and we are aiming to continue our collaboration with International Atomic Energy Agency to ensure that SIT is becoming one of the tools for vector control in the European region.
So I believe the International Atomic Energy Agency has a large facility for mass production of these sterile mosquitoes, isn't it?
Yes, exactly. And during our meeting, actually, one of the meetings in Vienna, we visited that facility. It's really great.
Yeah, let us hope that in the future this becomes a very acceptable technology and is very effective in dealing with this type of problems. Moving on to my colleague, Dr. Jolin in CRO New Delhi. Jolin, in Southeast Asia region, you have made tremendous progress in eliminating visceral leishmaniasis. And this requires a robust surveillance system in order to check the further spread or containment of this disease. So how are countries doing this in a more sustainable manner?
Thank you, Dr. Rajpal. So as we all know, the visceral leishmaniasis is a public health issue in Southeast Asia region. In India, Nepal, and Bangladesh are the endemic countries. In addition, Bhutan and Thailand reported sporadic cases. 99% of the endemic blocks in India and 87% of the endemic districts in Nepal already achieved the target. Bangladesh has sustained this status since 2017 to date and is preparing the dossier to submit WHO for validation of it. Instead of making the significant progress as you mentioned, the visceral leishmaniasis still persists in the selected endemic IUs. A few factors might be the weak reporting of the relapse cases, a rise in the PKDL cases, and insufficient vector surveillance techniques. Vector surveillance is, of course, a critical component in ensuring the success of the real elimination effort and can be strengthened by employing the GIS, the Geographic Information System technology, in triangulation with the line listing cases of the BL and the PKDL at the village level to detect the hotspot locations to respond as a focal intervention after reaching the target. And another important thing is the human resource management for the vector surveillance and integrated vector management, and that the countries should be strengthened. Enough well-trained workforce with the proper carrier ladder for entomology is vital to all vector-related activities during surveillance, including the surveillance.
Great.
We should have a clear plan with the timeline to integrate with other vector surveillance systems such as the malaria, dengue, and Zika. In addition, we also need to develop the integrated vector surveillance and management training module in which we have to focus the three vectors such as the Aedes, Anopheles, and Sandflies together as a one module, not as a separate three modules in one training. And vector surveillance, including the regular insecticide monitoring, should be practiced routinely, as mentioned by the Dr. S20 in the earlier discussions. And also, finally, research to study the changes in vector bionomics and effect of the climate change on vectors should be also encouraged for vector surveillance. I also would like to request the countries, partners, and donors to invest more on the vector surveillance, even after validation of the elimination of the VL as a public health problem, to sustain it and further targeting the interruption of the transmission efficiently. Thank you.
Yeah, thank you. So in short, can you tell us something about GVCR? Because all WHO regions had adopted implementation of GVCR in 2017, and now GVCR is being implemented in your region as well as. So how effectively your region can implement GVCR? Can you give in a very short reply in 30 seconds?
Okay, thank you. Thank you. So in our region, the vector control needs assessment has been carried out in 6 countries out of 11. So this is a good entry point for us. And also the effective application of the 4 pillars of the GVCR action can play a significant role in elimination of the vector-borne NTDs, for example, the VL elimination in our CR regions. So within country, inter and intra-sectoral action and collaboration is very important as well. Collaboration between the 3 neighboring countries, India, Nepal, and Bangladesh, and 4 bordering Indian states, Bihar, Uttar Pradesh, Jharkhand, and West Bengal, through the real-time data exchange and collaborative surveillance, monitoring and evaluation of the vector control intervention will be critical in the elimination of the VL and sustaining of it. The need for the research also to create the new surveillance and control methods and integrate the strategy with other vector-borne controls will be an added benefit. Finally, we will accelerate our advocacy efforts with all stakeholders, including the national governments, potential partners, and donors, to enhance the effective implementation of the GVCR in our region. Thank you. Back to you, Dr. Rajpal.
Thank you, Dr. Jolin. And viewers, you have seen that starting from the American region up to the Southeast Asia region, our colleagues in the regional offices are doing different things, including capacity building, developing normative guidance, developing new technologies, and implementing these technologies at the ground level to bring down the vector-borne diseases threat. So with this, I hand over back to Ashok for the further panel discussion. Thank you, Ashok.
Thank you very much, Rajpal. But before you go, I just wanted to, because we've received a very interesting question here, and I wanted to ask you that question, if you may allow. So what is WHO doing to support studies that address the monitoring of insecticides resistance pattern?
Okay, so of course, this is a very important topic, and WHO has, particularly the Global Malaria Program, has started a threats map site where all data coming from the different regions are being collated and presented in a map form, real life map form. So this is one resource. But the other work that we are doing in terms of the NTD vector-borne disease is that we are also trying to develop systems to bring in data for ADs and other vectors of NTD diseases, so that those data can also be integrated into the same system rather than creating duplicate facilities at WHO headquarters level. Now, in order to facilitate the countries, we have also done 2 more things. One is that we have just concluded a 5-year multi-center study wherein we have established discriminating concentrations of almost 17 new insecticide compounds for Aedes and Anopheles mosquitoes, and we will be supplying bottles and insecticide treated papers to different countries to monitor insecticide resistance. This is one thing. We are currently also doing a multi-center study with sandflies, because sandfly papers were not available, and so far people were using insecticide treated papers for mosquitoes to test insecticide resistance in sandflies. So this study actually will create a database, and we will start supplying insecticide papers specific for sandfly resistance monitoring. So I think this is a global effort. Currently, the NTD vectors data is very poor, but of course, backing on the malaria database, we can really build more effective database for insecticide resistance monitoring globally. Over to you, so.
Excellent, Rajpal, and thank you very much. And I think we'll take a short break with a very brief video about the roadmap then. And the roadmap and the targets it sets for 2030. So welcome back to this last segment of our discussion. And in this section, we have Indra Vaitilingam from Malaysia, James Logan from the UK, and Steve Lindsay, also from the UK. But first, to Indra. Indra, innovative tools and improved surveillance are critical pillars of GVCR, as you may imagine. You recently completed a randomized study on using traps and NS1 kits for dengue surveillance. Tell us some of your key findings here.
Thank you, Ashok. Yes, we set up the Gravit oviposition sticky trap, which is very cheap. It only costs US $0.4. That's about just US 40 cents. And we set up traps every week. We collect these mosquitoes and we detect the dengue virus in the mosquitoes using the NS1 kit. So it's a very simple method to detect dengue virus in mosquitoes. And we have found that lag of 2 weeks after positive mosquitoes are found, we get cases of dengue cropping up. And so there is a positive correlation between positive mosquitoes and dengue cases. And we have also found from our results that pre and post, we found that dengue cases had decreased in treated areas by 39%, whereas in our control areas where we set up trap once a month, it reduced by 87%. But in the negative control area where the ministry just carries on what is being implemented, there was an increase of dengue cases by 15%. And we also found that there are asymptomatic people in the area, because once a positive mosquito is found, we go back to the people and we take blood samples if they allow us, and we also help educate them. And we found that there are asymptomatic people, and these people are positive to the mosquitoes. So overall, we feel that this virological surveillance in mosquito can serve as an alert system to carry out control measures before dengue cases are reported. This paper has been published in Scientific Report in January this year. So people who are interested can read more about this. We feel that this is definitely a proactive surveillance and control mechanism for dengue.
And you prompted my question, because I was going to ask you where is this paper published, and thank you very much for sharing that information. So Indra, from your experience in the Asia Pacific region, how are programs integrating GVCR activities?
Oh, I mean, on this, I'm a little bit troubled because, as you all know, that Plasmodium knowlesi, a simian malaria parasite affecting humans, is present in all countries in Southeast Asia, perhaps with the exception of Timor-Leste. And we find that studies have been carried out, but this has been restricted to certain geographical locations. So there isn't enough information available on the behavior of the vectors, the resting habits of the vectors, and it is difficult for us due to this lack of information to decipher what control measures can be taken on these vectors. And we know that these vectors are biting outdoors and in the early part of the night. So I feel that we need a more collaborative effort from the academia, from the ministries of health, and the control programs, so that we can get more information about the parasites from the mosquitoes, the macaques, as well as from the human. Then we will have a better picture of how transmission is going on, and then we can think about what are the control measures that can be instituted, because all these countries are going towards elimination of malaria by 2030. So we got to really work towards this.
Right, right. And Indra, my last question to you is related to community work and involvement. So as we know, what improper water storage practices in communities contribute a lot to the spread of diseases like dengue. What is being done to improve this practice? Any concrete examples of community work you've been involved in?
Actually, we have been involved with the community when we were doing our randomized control trials. We have done KAPs, and we find that they have good knowledge. They have positive attitude, but unfortunately, it is not translated to good practices towards dengue prevention. Right. So at least we felt that when we talk to them and when we have been doing this randomized control trial, and when we tell them that you're going to get dengue is going to occur in a week or so, then we find that the people are more receptive. So at the end of our trial, at least they gave us the confidence that about 80% of the population in that area felt that this should be one of the measures to be introduced for prevention and control of dengue. They felt that this is a proactive measure. And also we feel that perhaps the public themselves will get more involved if they can know something is going to happen before it happens.
Oh, that's absolutely very true, Indra. And thank you very much. Turning now to James.
Welcome.
Thank you. Turning now to James. James, welcome. There you are.
Very much. Hi there. Can you hear me?
Yes, yes. So, James, the Global Vector Hub at the London School of Hygiene and Tropical Medicine, it is an exciting open access online platform. How does sharing and disseminating data contribute to supporting your capacity strengthening activities?
Thanks for your question. Well, let me start by telling you a little bit more about the Global Vector Hub. So it's an open access online platform that's aimed at capacity building, establishing a global community of practice, and improving epidemic preparedness by allowing for evidence-based decision-making. So it provides essentially information on vector control and vector biology, and that includes an entomological data repository and access to data, a searchable registry with a worldwide network. So we have more than 1,000 registered users across different sectors, across different stakeholder sectors, and also a resource database of training and educational materials, as well as vector control guidelines and research tools. So please do check it out, anybody who's listening who hasn't already, and please do sign up. Now, I think there are clear advantages to sharing data and having access to data in terms of strengthening capacity. And while there's a clear need, I think some of the main considerations that we have to think about as well are around accessibility, availability, and quality of data as well. That's something that we aim to facilitate through the Global Vector Hub and our partners. There's a lot of data out there in a lot of different formats, and our aim is to try and make that accessible in one place. And for also, for it not to be confined to one disease or one vector type. That's really important. Malaria often gets the limelight, but we want to bring together different communities, creating an easy one-stop shop, really, for people to upload the data and find the data that they need in one place. And the last sort of element of this is quality of data. Often data is not collected in a systematic or standardized way. It's a bit sporadic in space and time. It's often not consistent as well. So to address this, what we're doing is providing access to resources, training, guidance, education resources for all stakeholders from different countries and agencies, so they can all be found in one place to build and improve this community of practice, and also facilitate the interpretation of data depending on the individual user's level of knowledge as well.
Okay, James, thank you. And sorry, we're running out of time. Actually, we are over 6 minutes over beyond our allocated time. So I'm going to ask you one more question, and that would be, what complementarity do you see in the implementation of GVCR activities and the activities that you do at the Global Vector Hub?
Yeah, so I mean, to be honest with you, I think I've answered quite a lot of that in the previous question. You know, we certainly support all 4 pillars of the GVCR quite clearly with what we do, and it fits very nicely into that. I think it's also worth highlighting the importance of working with local as well as international partners such as CARFA in the Caribbean, or PAMCA or ATMAN, for example, and the importance of working with individuals. We are also supporting the foundation goal of enhancing vector control and capacity and capability through education and training. So, for example, together with TDR, we've launched an online directory of training courses in medical entomology. That's 133 courses from 32 countries in 10 different languages. Also hosting massive online courses on Zika, and a recent one on the global challenges of vector-borne diseases and how to control them, where we've had more than 25,000 registered users. We've got a call coming out for improved training on Anopheles stevensii. And we've actually also been doing a lot of work around educating and training in COVID. I mean, we have to operate in a pandemic world right now.
Right.
So we mustn't forget the importance of that as well. So we're supporting lots of areas of the GVCR.
Right, James, and thank you very much for sharing your perspectives with us, and thanks a lot for participating. I would turn to Steve Lindsay now. Steve, welcome to the program, and sorry about getting to you so late. I mean, we are almost 8 minutes beyond our time, but Steve Lindsay, as you know, is a former professor at Durham University in the UK. Steve, you were part of the team that developed GVCR in 2017. What were the initial challenges in implementing this global framework?
Good afternoon, Ashok, and hello everyone, and I'll try and keep this brief. I think a number of challenges have been discussed previously, but I think for me the most important one is the lack of progress that we're making on intersectoral collaboration. And so my wish is for people within the vector control departments to cross the corridor and go and speak to people from the built environment, from the engineers, city planners, people that understand water and sanitation, because one of the things which is critical as we build our future cities, because by 2050, 7 out of 10 people are going to be living in cities where there will be a threat from Aedes transmitted diseases and malaria on the fringes. We really need to do better in the area of prevention. And what I'm talking about here is reducing aquatic habitats for mosquitoes, all mosquito species. And so what do I mean by that? So to reduce Aedes breeding site, getting reliable pipe water in, clearing waste, and screening houses. These are important for reducing the force for infection and giving people a comfortable night's sleep as well. That requires activity beyond health. It's incorporating other sectors. So I think that is fundamentally important. Prevention is always the poor cousin of infectious diseases, but we miss an opportunity here because what we're doing is actually building into our cities and towns breeding sites for mosquitoes to exploit and spread their diseases. We need to do better and build out these breeding sites.
So, Steve, and this rightly brings me to the next point, which I wanted to ask you, is you mentioned that we need to work with other sectors as well. So can, for example, if you look at the habitat and the environment, can modifications to housing, for example, contribute to controlling and eliminating vector-borne diseases?
There are so many opportunities for thinking about what we're doing. So improving drainage, so surface water doesn't accumulate. For improving houses by making it easier to screen houses, or building houses from the start with screening rather than retrofitting. And it's about thinking ahead, because so many of the population that are going to be born over the next 20 years, the houses haven't been built. The areas haven't been built. And most of these extensions will occur in the smaller towns and cities around the world, not the global capitals, the smaller towns and cities. And there lies an opportunity to think ahead and plan plan ahead to reduce these habitats. And the real key here is not thinking so much at the national level, but getting this to work at a city level, city or town level, where you have the energy, enthusiasm, and capabilities of city mayors and leaders who can drive this forward. This is a new approach. Now, the language of resilience is a new one to health, but for those people that are thinking about and work in cities, that's a common understanding, building resilience into our cities and towns for the future. And we should build resiliency against the threat from these environmental diseases and build out these mosquito-borne diseases.
And with all the things happening around us, Steve, like climate change and urbanization, as you rightly pointed out, is also the growing menace of vector-borne diseases in environment. How do you see GVCR moving in tackling the rise of vector-borne diseases moving forward?
So GVCR should be front and central for every vector-borne disease control advocated by WHO. And whilst within the NTD arena, that's strongly supported, it's not supported so well in the malaria sector. And those folk in malaria need to look broader and not just on insecticide-treated bed nets and IRS. So that's about advocacy being important. The second thing is going back to this city-led initiative. I think there are extraordinary opportunities to do this, because don't forget, it's not just about control of mosquitoes we're talking about, it's improving the infrastructure, particularly in some of the poorest parts of a town or city, to improve the quality of life and modernize cities. And it's that modernization that we need to think about for improving the environment for our city and town residents for the future.
Excellent, Steve. Thank you very much for sharing your thoughts with us, and rightly so. We should be focusing on many other issues beyond what we are doing right now. And colleagues, this brings us to the end of today's webinar. We also look forward to reading your suggestions and comments on how we can strengthen GVCR across diseases in a post-COVID-19 world. So thank you for your attendance, and from the entire WHO webinar team in Geneva, it's goodbye.